Hello practical nursing students, this is Darlene LaPresto, nursing instructor, and with this video I want to show you different devices that we use for nasogastric tube feedings. Now as an LPN you are not allowed to put an NG tube inserted into a patient. The RN or physician will do that, but you are responsible to monitor that NG tube once it's in the client. So what I have here first are some different types of nasogastric tubes. The first one here is called a Salem sump. And it's a dual lumen stomach pump. And again, these are measured in French. So this is a 14 French. And notice with this one, it has radiographic markings on it. So when it's inserted through the nose, down through the stomach, or through the esophagus, down into the stomach, the radiologist is going to be able to see these markings to make sure it's in the right spot. So it's not in the bronchus, that it's actually down the esophagus into the stomach. And then this end is, this is an extension device, so we would take that out. And this end is connected to the suction tubing on the wall unit at the patient's bedside. This is an air release valve, so you don't want to kink that or plug that up. And that is for suctioning to remove stomach contents for a patient who, let's say, has a small bowel obstruction or some other post-op ileus maybe, where they are building up gastric contents and their peristalsis has slowed down. So we are not feeding these patients. They are NPO and we are taking fluid out of the stomach. Up here are some feeding tubes. So now these clients, for whatever reason, are unable to take nutrition orally. So we have to either temporarily or permanently put a feeding tube down. So again, it's the same. We put it through the nose, down the esophagus, and into the stomach. And these are some different sizes. Here we have a little teeny pediatric one. You can hardly see that one. And here we have another pediatric. And then the white one that we have here with the purple tip, and notice purple is supposed to be a quick identifier that this is a feeding tube and not IV tubing. And I'll show you how that correlates with the feeding bag in just a minute. This is called a Dobhoff tube, and this is put down for longer term feeding. It has a mercury weighted end on it, and then it has a wire in it to make it a little stiffer so it's easier to place. And then once it's placed, they take the wire out and they're then allowed to attach it to the tube feeding device. Usually it's hooked to a pump. It also has a secondary vent to put medications down at the same time or to rinse. Okay, now remember that tube. And I'm going to show you, I'm going to skip this middle section and I want to show you the tube feeding pump and the bag. This is called a kangaroo pump, and here is our kangaroo bag. Notice the purple. This is to remind everybody, hey, this is not an IV, this is tube feeding. Because believe it or not, some people have hooked up tube feeding tubings to IVs. I know, it doesn't seem possible, but it is. So the ends are purple to really say, hey, to the nurse, pay attention, this is a tube feeding. Okay? And that would be put in the pump. We would program the pump to how the physician, how quickly they would want us to administer the feedings. We have osmolite is just an example. There's many different types of feedings discussed in your book, and there's a graph in there. The dietitian usually writes the order after she assesses the patient to see how many calories that they need depending on what's going on as far as the illness of the client. So the physician and the dietitian work hand in hand. Now here I have laid out on the blue pad for you what you'll need, I believe, for when we check residual for the NG tube. So you've got your graduated cylinder, and sometimes you'll see this in the bathroom because we do use it to measure urine as well, and we use it to measure whatever we need. So in this case, it'll be contents, gastric contents. We have what's called a bulb syringe, and it has clear markings on it. I want you to notice the tip. Again, it's different than the IV tip. It's a big tip. Okay. We have our measuring tape so we can measure how much of the tube is outside of the patient from their nose to the end of the tube to make sure it's in correct placement. We use this to instill a little air. Some people still do that, some people don't. And then we listen for gastric bubbling to check for placement, but the best way to check for placement is by using the gastric strips. And we'll talk about this in class. And so what you do is you remove some gastric content with your syringe. You hook it to the feeding tube and you withdraw some gastric content. You put it in your medicine cup and with your stick in there, and be sure the gastric secretions cover that. And then after a couple of seconds you read it, and this will tell you. So you have to know what your normal gastric pH is versus respiratory. And we'll talk about that in class. And then you discard that and throw it away. You always have tape available in case the patient's NG tube is loose and you want to re-secure it. And then we have a kidney basin and some toothettes to provide oral care. Patients who have NG tube feedings need to have frequent oral care. Okay? We will go over this more in class, but I just wanted you to see some of the equipment that you may see in the healthcare settings. All right, thank you.